Thank you all for coming this morning. My name is Carlos Sanchez. I'm the Public Affairs Director for Hidalgo County. I would like to introduce you to County Judge Richard Cortez at this point.
Good morning, everyone. Today is nothing more than an update of what Hidalgo County is doing, to prepare for this coronavirus. As you know, you've heard that there's a presumptive case already possibly in Texas. So to be very prudent in our decisions, we wanted to take a very conservative approach in preparing Hidalgo County for any possible threats at all. So for that reason, we chose to go to level 3, and we'll have Mr. Olivares give you the details of what a level 3 is. But basically, we wanted to make sure that we were receiving the best information we could, that we would be receiving all the resources that are available to us to make sure that we are in total preparedness in the event that we would have some incident here in Hidalgo County. So for that reason, we want to hold this. Now, a lot of people are receiving information from various sources, and some information is reliable and some information is not reliable. So what we're going to do here in Hidalgo County is to make sure that we give you periodic information that is reliable for you and the public to be able to use it to protect your families from this threat. So with that, I'll turn it over to Mr. Eddie Olivares, who is our Health Department Coordinator and Chief.
Good morning, everyone. My name is Eddie Olivares. I'm the Chief Administrative Officer for Hidalgo County Health and Human Services. I'd like to thank Judge Cortez and his leadership in helping get information out to the public, and of course, Chief Ricardo Saldaña, our Emergency Management Coordinator. And of course, we have Mr. Rodriguez and our DA's office represented and the court represented here as well. So let's talk about what Hidalgo County has done and what are we going to do. First of all, I want to start off by saying there is no confirmed cases of coronavirus or COVID-19 in Hidalgo County. I'm going to repeat that. No cases in Hidalgo County, no cases in northern Tamaulipas. That we have that information as of this morning. To make that very clear. The other thing is that the reason we have been working for the last 6 weeks, 5 weeks on this, we've actually been monitoring COVID-19 since around December through now. But we want to make real sure that everyone understands there's a lot of misinformation out there on social media. There's a lot of misinformation that we want to develop the public trust to let them know that this is where we stand. So there being no cases, just recently there was a presumptive case announced in Fort Bend County, just south of Houston in the Sugar Land area. Presumptive means that the local lab, Houston, confirmed a case through their laboratory. However, officially, the CDC out of Atlanta, Georgia, must be the ones to confirm those cases. So they are waiting to see the result from that case before they say yes or no. If it is so, that is a traveler, a person who traveled to Italy, came back, was symptomatic, followed through on CDC protocol, went to the physician, got tested, got assessed, and that was done, and that's where we are with that. Currently, again, there is no cases here. So what we did, since that is going to be one of the first ones outside of the people who were at Lackland Air Force Base here in Texas, we decided to lift our level of awareness and activity to a level 3 Bio-Emergency Operations Center for monitoring. In the state of Texas, there are different levels of emergency operation. Level 3 is a heightened level of awareness, but not at a point where there's a declared emergency. There is no declared emergency, none at all. But by heightening our operations, I'm able to bring in other resources to assist us. The county DA's office, for example, is assisting us. The county safety division is assisting us. The county executive office is assisting us. The county public relations office now will take the lead for dealing with all media and public relations. So we're just kicking it up a notch. And the reason for that was because we want to make sure that we're able to deal with information and all the things that come in as quickly as possible, but as accurate as possible. There's been a website developed by our public relations office. Many of you have announced it. Thank you very much for announcing it. So there's a lot of information on there. There's some video vignettes that have been developed to produce information. There's going to be a list of frequently asked questions set up by this afternoon on there as well. So that'll be more of assistance to the community. Hidalgo County Health has been doing a series of presentations and reviews for many weeks now. We've met with Region 1, all their school nurses from Region 1. We do phone conferences because to try to get 100 or so people to come into one room by the next day is difficult. It's easier for us to do conference calls. So we've done Region 1 conference call. We work with the cities and mayors of all our county. We work with all the hospital administrators. We're putting on a conference call with all nursing homes, dialysis centers, and hospice centers. That is taking place. We are going to be planning up this coming week a regional training component, which we're going to train the trainers, and we're going to train some community leaders and promotoras and community activists to help us go out and educate the public on the prevention of coronavirus and flu-like illnesses. That's going to take place, along with a series of other events that are going to be happening in the days to come. The Operations Center, again, is to focus strictly on preparedness. We have no community spread. We have no cases. We're working closely with all our hospitals, with our EMS, with our first responders. We're working closely with all of them. The main focus here is just to be ready when it happens, if it happens. Right now, there is no need to look at any particular social events. I know we got several big events happening. There is no need to change that. There is no cases here, none. So, but everyone needs to have their awareness at a heightened level. The hand sanitizing or washing your hands, the making sure you cover your mouth when you cough and sneeze, wash your hands with soap and water. All those things need to be understood and encouraged. We're encouraging all the cities, we're encouraging all the businesses that make sure you have soap in your bathrooms, make sure you have plenty of opportunity for people to wash their hands, give them that opportunity. Also, any events that are taking place outside, we encourage to have hand washing stations and stations available. So if there's an event outside, you know, they have those little hand stations outside the little porta potties out there. Have those ready and use those frequently. We encourage people to do that. If a person is exhibiting any flu-like illness, which we have the flu right now in Hidalgo County, a lot of flu. If you're expressing or showing flu-like symptoms, we encourage you to stay home. Just rest, do what the doctor says. If you have a fever, please contact your physician to get assessed for the influenza. There will be no need to get assessed for coronavirus, but just check for flu because we have a lot of that as well. Remember, there's questions to be asked. There is right now under travel advisory, there's 4 countries, level 3 under CDC, that they're discouraging travel unless it's extremely essential. China, South Korea, Italy, and Iran. Those are the level 3 countries on the travel advisory. CDC.gov has that. If you go to our county website, click the CDC.gov information, it'll help you get to that state, to that area. If you're traveling to those areas, please be aware that those are the countries that we're concerned about. There's a lot of misinformation revolving spring break, okay? Spring break is upon us. We have a lot of schools locally that have trips planned during spring break. What we're telling the school districts that they need to review their operation plan, they need to review their infectious disease plan, and they need to review that with the parents, and the school and the parents need to make that decision. It is not the decision of the health department to say whether you could go on your spring break trip or not. That is not our role. It is the role of the parent and the school district to make that determination what they're going to do. We also are working closely with UTRGV. There's a lot of misinformation involving UTRGV and Texas Southmost College and some of the other schools of higher learning. UTRGV has been extremely proactive, very proactive. We've been in contact with their emergency manager for the last 6 weeks. Okay, we've been working with them almost daily. And they've actually, their international program has been postponed for the last about 3 weeks, going on 3 weeks, maybe 4 weeks. They have discouraged any travel to any of the high-risk countries or even the medium-risk countries from their staff or their students. There was some discussion about some students that were coming back from one of these countries. UTRGV and their team, they have a protocol they're following to deal with that student or those students. In the event that that were to happen, there's followed through a CDC protocol. Many times it involves just home isolation, self-monitored at home, following through with your local physician, and making sure that you're okay. To this point, we've had no symptomatic travelers, no symptomatic cases, none to this point. We don't know what the future holds. So that's on travel. That's very important, and the universities are doing a very good job about monitoring that. We've worked with the Department of Homeland Security. We work with the Office of Border Patrol. The judge and his team met with the high-level officials at CBP 2 weeks ago, met and talked about immigration concerns. Chief Saldana and myself met with them late last week and came up with a very clear plan and guidance. We met with the hospitals and talked about the guidance in dealing with immigration and dealing with those issues as well. We've talked to our partners in Mexico, the Secretaría de Salud. We spoke to them very clearly and reviewed their refugee camps and their facilities or shelters. They're assessing all those immigrants. They're checking that out, making sure that they're in a stable situation. That I'm aware of, there's only 6 cases in Mexico, unless something came up overnight. There's only 6 cases in Mexico. Some of them are Sinaloa, Mexico City, and Coahuila are some of the areas that they have them. Those are there as well. So we're looking at the international and binational issues as well. There's 11 airports throughout the United States that deal with foreign travel. CDC is based at those 11 airports, and they're screening and assessing those people who land, who come forward. So we're looking at those areas as well. So I'll pause right there. Judge, any closing comments or words? Chief Saldana?
We're open for questions.
We're open for questions.
We have gotten some people, Channel 5, we have gotten some people message us in regards to they have wanted testing, but they've been denied testing. You talked about testing if people want to get tested.
Sure.
I know if they're freaking out, but.
So testing is not public testing. It's not like flu testing. The thing with testing, you need to get in contact with your physician, review it. There is a guidance set by the CDC on how testing is done. If you are asymptomatic, okay, and the symptoms for COVID-19 are heavy coughing, respiratory complications and breathing. And the most important thing, have you traveled to any of these high-risk nations? Again, China, South Korea, Iran, and Italy. Have you been there in the last 14 days? If you have not been in those areas, there's no need to be tested, and there's no need to be worried about that. Other questions?
Can you talk about La Jolla? I know La Jolla sent an email earlier this week
Yeah.
that they had in contact with San Antonio. Talk about what exactly monitoring means for.
So La Jolla School District put out a release that they had some students take part in an activity at North Star Mall, which has been public information, right? The students were in the mall doing their tourist thing. There was a question about a person in question involving that went to the mall. They were not there at the same time. We know exactly when the person was there. The students were not even the same day in that mall. We met with the families and discussed all this with them. We explained everything to them. But this school district, La Jolla, felt it necessary to send some type of release to their students and their family. But those students had 0 risk or minimal risk. And I have to say minimal because I can't be 100% that it's 0, but extremely low risk or pretty much no risk of being in contact with that person because they're not even there the same day. But that's where that's at. Other questions?
Across the country, they've been saying that health officials don't have enough kits to test.
Mm-hmm.
Is that something you need to
So the state of Texas, I can't speak for other parts, but the state of Texas has been working with the CDC, and we're thinking next week, we were announced last night, we have a daily call with the Department of Health Services every day, and the judge's team is on it, along with many other emergency management personnel are on it. They announced yesterday that they're going to expand testing in Texas, hopefully as early as next week on Monday, to include what they call the LRNs, their laboratory resource network systems. The closest LRN to us is in Harlingen, and they're going to be expanding that to those locations to be able to do testing, but the testing must be in accordance to the CDC guidelines and in accordance to the state guidelines. It's not open to the public. It's not a public testing situation. This would be only in areas where there is need in accordance with CDC guidelines. So hopefully, to answer your question, by next week we'll know more about how many kits there is. Right now, I don't know. Other comments?
Para nuestra audiencia en español, ¿podría decirnos un poquito
Okay.
la importancia de que no hay coronavirus aquí en el Valle?
Well, ahorita lo hago en español. Any other questions in English? All right. Yes, go ahead.
Just,
You're limited to 3 questions, man. This is it, number 3.
I mean, going off kits, going off medication for care, if we do have coronavirus here eventually, do you guys feel ready and prepared for that?
We feel ready and prepared to deal with the situation at hand. We have dealt with H1N1. We have dealt with mumps. We have dealt with other issues in our community before. However, it takes a team to do that. It takes all our community to participate. I need our residents to be calm. They don't need to panic. We do not have it here yet. Is it going to be here? Probably. When? I don't know. But the more that they start practicing good hygiene, social distancing, and just plain awareness, the better. Okay? Any other English questions before I go Spanish? Okay. Buenos días, me llamo Eduardo Olivares, soy el administrador del Departamento de Salud y Servicios Humanos. Hoy mismo aquí en el condado de Hidalgo no hay ni un caso del virus corona aquí en el condado de Hidalgo, en la frontera aquí en el norte con Tamaulipas, ni un caso confirmado, ni un caso. El único caso que está en Texas es en el condado de Fort Bend, cerca de Houston, y ese caso no está confirmado por el CDC, pero se está investigando en este momento. So, no ha habido ni un caso aquí en el condado.
Las recomendaciones para los viajes que ya se viene la Semana Santa.
Okay. You know what? I forgot to talk about Easter and Holy Week. Good question. So, para nosotros es importante que hay diferentes países en el mundo que no se recomienda que vayan de vacación o de negocio. Si van al cdc.gov, ahí se pueden comunicar para ver los diferentes países que se han anunciado. El país de China, South Korea, Irán y Italy. Son los países. Italy es muy importante entre Semana Santa. Se ha anunciado que si no tienen que viajar allí, no vayan a esos países porque ahorita la enfermedad está seria en esos países. Si usted, también es importante que todos los familiares entiendan algo. Hay bastantes viajes y actividades que están en el horario de familias en esta semana de Spring Break y la Semana Santa. Muchas escuelas lo están llamando que si dejan a los niños ir a los diferentes viajes en diferentes lugares, esa decisión es de los padres. Los padres y la escuela hacen esa decisión. No es parte de nuestro trabajo para hacer la decisión de un padre. Los padres son los que van a decir si van o no van al viaje.
¿Qué tan preparado se podría decir que el condado de Hidalgo está para un coronavirus aquí?
El condado de Hidalgo ha trabajado con varias enfermedades antes. El virus H1N1, hemos trabajado con el virus de mumps o paperas, hemos trabajado con diferentes enfermedades antes. No es la primera vez que trabajamos con una enfermedad, un virus. Nosotros estamos preparados para asistir, pero es un equipo, el equipo con los hospitales, los doctores, la comunidad. Pero el miembro del equipo más importante son los residentes. Los mismos residentes pueden asistir si hacen lo que deben hacer. Lávense las manos bastante con agua y jabón, cubrirse la boca cuando estornudan o tosan. Si se sienten mal, vayan a su doctor y comuníquense con su doctor. Muy importante que la comunidad pueda asistirlos. Otra pregunta en inglés que dijeron, voy a decir en español, los diferentes eventos que están pasando. Hay muchos eventos que están pasando. Podemos ir a esos eventos. Ahorita no hay ni un caso en el condado de Hidalgo, no hay ni un caso en el condado de Cameron que sepamos nosotros. Todos tomen parte de estas oportunidades de tomar parte en este área del Valle, del área de Texas, que está hermosísimo. Tomen parte en esas actividades, pero recuerden, lávense las manos de hilo, tápense la boca. Si una persona tiene problemas con enfermedades, immunocompromised illnesses, o tiene flu-like illness, mejor quédense en la casa y descansen un poco, pero tomen parte en todas las actividades.
One last question in English.
No, man, you already had 3.
Remind us
Everybody, please tell them you can't.
Remind us
You
about
have to
the,
leave $4 because it costs you $1.
There you go.
remind us about the issue with the mask. I know there's the theories behind it.
There is no issues with masks. The only issues with masks is that you can't find them. The biggest issue is People do not have to wear masks. They don't. The only people that must wear masks is by doctor order. If you are immunocompromised illness, HIV, AIDS, you're under advanced dialysis or chemotherapy, you've gone through a organ transplant, your physician will prescribe for you to wear a mask because they don't want any germs coming into you. All right? So please don't fear that. Tuberculosis is common. You see a person wearing a mask. So the use of masks is not necessary. It is not prescribed. Thank you.
So I want to deliver a couple of logistical issues. I'm going to be issuing a media advisory later on. Under this heightened precaution status, we intend to give you advisories, probably via conference calls on a more routine basis. I will give you a sense of the schedule and where to call to get updated status throughout this event. That concludes our press conference. If you have any additional questions or information that you need, please go to our website and you will be getting some news releases as you leave. Thank you all.